I'd like to invite onto the dais our Honorable Minister for Industries, Shri Rajiv, and may I please request Dr. Anil Kumar, Organizing Chairman, CHIP 2022, to kindly accompany him. I also would like to invite onto the dais the Chief of Medical Services at Aster MedCity, Dr. Anup Warrier, Dr. Rajashekhar Verma, Coast Director of CHIP Summit, Dr. Deepak Davidson, Coast Director again. We'll begin the inaugural session with a prayer. May I request you all to rise, ladies and gentlemen. May I invite Ms. Chandni to kindly do the honors, please.
प्रणवात्मकं श्री परमेश्वर गौरीसुतं भक्तजन प्रिय प्रणवात्मकं विघ्नविनायकं एकदन्तं विघ्नविनायकं एकदन्तं प्रणतोऽस्मि गणनाथ विश्वेश्वरं प्रणतोऽस्मि गणनाथ विश्वेश्वरम्.
Thank you, ladies. May I request Dr. Anil Kumar now to deliver the welcome address, please.
Good evening. This is my proud privilege to welcome all of you to this CHIP Summit 2022. We have in our midst our own minister from Ernakulam, the respected Sri Rajiv, Minister of Industries, who has taken time out to come all the way to honor us and make a formal inauguration of this function. I welcome Minister Sri Rajiv to this audience, and I request him to be honored with a bouquet. We are here with the Chief of Medical Staff of Aster MedCity. Aster MedCity has been very supportive of this Congress, this CHIP Summit, which is a unique conference, and we have had extreme support from the whole of Aster MedCity administration. Dr. Anup Warrier is the Chief of Medical Staff, and I request him to be welcomed with a bouquet. We have had very prominent faculty. Can I request the faculty to come on to the front sofas? Please come forward. We have had brilliant international faculty all the way from US, and we have had faculty coming in from Australia, and we have had faculty contributing their knowledge from Japan, UAE, and we have all benefited during the course of the day, and the whole faculty, all cardiologists here who have come are going to benefit from their interactions today and tomorrow. A warm welcome to all of you. Thank you. The national faculty has also contributed the bit, and all seniors are here. We can, in fact, somebody was asking, the cream of cardiology is here contributing to the complex angioplasty, and all of us are benefiting, and all of us are learning from each other. A warm welcome to the national faculty as well. No conference can be successful without the intense participation from the delegates. And we have had delegates coming from the north of India, south of India. We have had faculty delegates coming in from Mauritius, and we have had people contributing to these scientific sessions, and all the delegates have benefited. A warm welcome to the delegates, and please continue this interaction into tomorrow as well. Such a conference would not have been happening without our industry partners, and I welcome all of them to this gathering as well. CHIP Congress has been happening. I mean, it's not been a very old thing. It's something very new. So I think we all are very benefited by this Congress. I warmly welcome all the industry partners, all the delegates, and all the staff members, and all the people who have come to this evening to be participating in this inaugural function. Thank you.
Thank you very much, sir. It's my privilege now to invite Dr. Rajashekhar Verma to kindly speak on the concept of the CHIP Summit.
Honorable Minister Shri P. Rajiv, respected members on the dais, ladies and gentlemen, It's my pleasure here today to introduce the concept of CHIP. CHIP stands for Complex High or Higher Risk Indicated Procedures. So here there are three basic elements. One is the complexity that depends on the coronary anatomy, depends on the concomitant cardiac diseases, and also on the patient's comorbidities. Then you have the risk, which is determined by a lot of different factors. And in doing procedures on these patients, we have to ensure that these procedures are truly indicated, that they do benefit the patient despite the complexity and despite the risk. So, no risk, no gain, but yet the benefit from the procedure should exceed the risk that we take. As we know, there's been a lot of advances since Dr. Grunsik first did the first angioplasty. A lot of advances have been there in our understanding of the disease, in the technology that has come since then, and in the knowledge and in our skills, the hardware that is available, the types of cath lab we have. So all these contribute to us taking on more and more complex lesions, things that could not be done in the past, things that required very complex bypass surgeries and other similar very high-risk procedures. Now, many of these procedures are being done after carefully assessing the risk and by a responsible heart team approach, which actually takes care to ensure the best practices and the best outcomes for every patient. So, this Congress is looking at all these aspects of CHIP and trying to devise ways in which we can extend the benefits of these procedures to more and more needy patients in our own place, in our own country, and those patients who really deserve the benefit should benefit, the cardiologists attending the conference should benefit from this conference in such a manner that these benefits are translated to actual patient care at the bedside. This is about the concept of CHIP. Thank you very much.
Thank you very much, sir. Dr. Rajashekar Verma, Co-Director of CHIP Summit. May I invite Dr. Deepak Davidson, Co-Director, CHIP Summit, to share his thoughts on the evolution of the CHIP Summit 2022.
Honorable Minister of Industries, Sri P. Rajiv, dignitaries on the dais and off the dais, my dear friends, senior teachers, the evolution of CHIP, it's basically the brainchild of Dr. Anil Kumar, the head of the Department of Cardiology at Aster Medicity. During 2019 EuroPCA conference, me, Dr. Dr. Verma and Lijo, we were all together during the meeting, and that's the time when he put forward this particular concept that we have a lot of meetings on bifurcation, CTOs. Why don't we have a session dedicated to the complex high-risk patients? How do we do it? How do we avoid complications? What about safety? What about the renal issues? So that's how it evolved. And so we had the initial edition done in 2019 at Aster Conference Hall. And beyond that, couple of years, we lost these sessions primarily because of the COVID pandemic. And now it was again time for us to revamp together. And we had a wonderful team. You all would have seen full crowd, the hall was full today right from the morning. And it was primarily a successful session today right from the morning till evening. And the success primarily, I should say that it was contributed by the entire organizing team, a group of like-minded cardiologists, right from Dr. Anil Verma, Dr. Sunil, Dr. Jimmy, then again we have Anil Kumar and Dr. Sunil Roy, and a good team of industry youngsters who were with us right from the beginning, who did good work with us. So I should thank. That's how it evolved, and we hope to have the next year, the third edition in 2023, in the second or third quarter. And I should once again thank each and everyone for being with us. Thank you once again.
Thank you, sir. It is indeed an honor to have in our midst Sri Rajiv, the Honorable Minister for Industries. May I request you, sir, to now light the lamp and inaugurate our CHIP Summit 2022. inauguration of our summit, CHIP Summit 2022, with the tagline of enhancing outcomes in complex PCI. Thank you, sir. It's our privilege now to invite our Honorable Minister, Sri Rajiv, to deliver the inaugural address.
Dignitaries on and off the dais, dear friends, it is a privilege for me to be here with you. Famous cardiologists of the city and the states are present here. Some of my friends are also here. Actually, before coming here, I have no idea about this conference because in my diary it is marked as a program of Aster. 2 days back, I spoke to Dr. Jimmy to inquire about a condition of a patient. At that time, he asked me, "Sir, are you coming to this function?" "Yes, I am coming. It's an Aster program." It's a program, but we are all cardiologists are there, will be there. It is a conference. Now, doctor told me it is CHIP, that is complex, high-risk indicated procedures. I am a layman to this terminology, but you all are well aware of this. Kerala is the state which is well known for its advantages in the Human Development Index, particularly in the health sector. We never allow coronavirus to spread over the infrastructure of our health system. That is the main positive side of state of Kerala during the pandemic. Yes, here is the growth rate is, spread rate is very high, sometimes compared to other state. Yes, here are several deaths due to coronavirus, but a single death is reported due to the non-availability of oxygen cylinder. Not a single death is reported due to the non-availability of ventilators. Not a single death is reported due to the non-availability of ICU facilities. This is a unique case in not only in the country, in the world. In United States of America, we had several deaths due to the non-availability of ventilators, ICU beds, and oxygen cylinders. I am holding the portfolio of industries and law. I am trying to strengthen the domestic productions of pharmaceuticals and medical devices. Recently, we have published a draft document on industrial policy 2022, discussing with the different stakeholders. Few days back, I had a very fruitful discussion with medical devices entrepreneurs. In that meeting, the director of Sri Chitra Medical Science was there. He told me, "Sir, Kerala has the best infrastructure facility for medical devices production." And next question he coined to me that, "Why, sir, you are not ready to propagate these advantages to the country?" I said, we are doing that, but the media is not ready to propagate these positive things. They are very busy with the negative things. That is the reality. In that meeting, we have discussed the stent production. Is it possible in state of Kerala? Then the director of Sri Chitra Institute told me they are on the process. They have developed it, and some companies are working with Sri Chitra to produce this stent. And also, we have a company which is producing blood bags. That is the largest blood bag producer of Asia. That is in Tirunelveli. We have a company which is producing artificial teeth. That is the largest in Asia. We have a medical devices company which has its regional offices in different parts of the world, but it is headquartered in Ernakulam district, Agape. Then these are the advantages of medical devices industry in the state of Kerala. Yesterday we had a meeting of KSDP. We have decided to start a oncology park in Cherthala. We have decided to establish a new company a PPP model with the leadership of KSTP with the support of Government of Kerala for for drugs with regard to oncology treatment. And cardiology, if any possibility to start any industry, then please advise us what can we as the government do for the development of industries producing any devices and any drugs applicable to cardiac diseases. And I had taken some step during my parliamentary tenure to establish some units for this angioplasty and angiogram cath labs, particularly in government hospital Ernakulam and some other hospitals in other parts of the state. Anyway, this is a good experience to state of Kerala. Mr. Dr. Anil Kumar has mentioned that some international figures in your sector is here. They have taken some classes for you in the morning section. All these outcomes would help to the health sector of the state of Kerala. By these words, I declare this CHIP Summit 2022 being inaugurated. Thank you.
Thank you, sir. May I request Dr. Anup Warrier, Chief Medical Services, Aster Medicity, to kindly hand over a memento to our Honorable Minister as a token of our gratitude for his support and presence here today. The mandatory photographs. Thank you, sir. Thank you so much for being so supportive. May I request Dr. Anup Warrier to kindly hand over a memento to our Honorable Minister, please. Thank you, sir. May I also request Dr. Warrier to kindly offer his felicitations on the occasion.
Good evening, all. Well, I take immense pride and pleasure in being a part of this conference here today, representing Aster Medicity, and for the little support which you have been able to give for this wonderful initiative. As Dr. Anil was mentioning, the support he got from the management, I assure you that he deserves much more, and we hope that we will be able to support you much more in similar kinds of initiatives going forward. He was pointing out to me some of the luminaries on the stage and also as a part of the crowd here. Glad to know that the who's who of cardiology, both within the state and out of the state, is here. That itself speaks volumes about the academic stature and the nature of the conference and the content of the conference. Finally, I am primarily an infectious disease physician, and this is the first time I came a bit early, and I sat through a couple of, maybe an hour or so of that live program of angioplasty. This is the first time in my life that I had seeing that, and with the live commentary sort of thing and comments all, I assure you I didn't miss the World Cup. It was as engaging to me as seeing the World Cup on the large screen. And with those few words, thank you all. I'm sure today was an interesting and informative session, and I hope that tomorrow also will be as informative and engaging as today. Thank you.
Thank you, sir. I invite Dr. Sandeep now, our Organizing Secretary of CHIP Summit, to propose the vote of thanks.
Honorable Minister, Sri P. Rajiv, Minister of Industries, Government of Kerala, I thank I thank you for your presence here, and I also thank Dr. Anup Warrier, Chief Medical Services of Aster Medicity. I thank Dr. Anil Kumar, who is the organizing chairman, who gave me the opportunity to be the organizing secretary. This is my first conference, which I'm conducting as an organizing secretary. Then Dr. Rajshekhar Verma for the excellent academic content, and it is the basic backbone of this conference is the good academic content, which was devised by Dr. Deepak Davidson and Dr. Rajshekhar Verma, and also the main support by Dr. Jimmy, Dr. Anil Balachandran, and we were able to pull out a good show, I feel. And also, a great thanks to the delegates, the faculty who traveled, Dr. Samin Sharma, who traveled all the way from US to attend this, Dr. Rastam from Australia, Dr. Bawalin sir from Trivandrum, Ajit Mullacheri sir from Chennai, Dr. Saranam from Coimbatore, and Dr. Arun Kumar all the way from Dubai. It's a great honor to have you all in this CHIP Summit and to enlighten us with a lot of knowledge. I also thank the staff of Aster Medicity, Dr. Joel, Dr. Vivek, Dr. Soni, Masood, Harsha, and Agnes, who were the backbone of the morning activities. They made my life very simple. And also, what you see here, the stage, etc., is mainly by Anish, and the support by Lijo, Ajit, Santosh, etc. And not the least, the industry and the pharma. It is just because of your support that we are able to hold it in such a good venue and with all the facilities that we are able to provide. Thank you all.
Thank you, sir. Ladies and gentlemen, kindly rise for the national anthem, please. Thank you, ladies and gentlemen. We come to the end of the inaugural session.